San Francisco has long been at the forefront of developing alternative, non-law enforcement responses to individuals in crisis. Our specially trained community paramedics, in collaboration with EMTs and peer support specialists, are on the front lines, responding to 911 calls involving mental health crises, substance use disorders, and homelessness-related medical needs. This approach is essential to meeting the changing needs of our 911 system, but it brings a unique set of challenges, one of the most significant being moral injury.
Hi, I'm Miranda Worthen.
Hi, I'm Michael Mason.
And I'm Soma.
Together with our civic and community partners, we set out to better understand the severity of moral injury within first responders, possible interventions to reduce its negative impacts, while also examining equity within this EMS system.
Moral injury occurs when you do something, you fail to do something, or you witness something that goes against your morals and values. This results in moral injury symptoms like guilt or shame or withdrawal, or for some people wishing like they could have done more. It really is a growing concern among first responders, and it's because of the situations that they experience as part of their occupation.
In partnership with the San Francisco Fire Department, we pursued a participatory research study to investigate moral injury among first responders. Our initial focus groups generated several intervention concepts.
The focus groups and team conversations also made us realize the need to understand and develop interventions to improve equity in EMS.
For many people who become ill or injured, emergency medical services represents the first interaction with the healthcare system. And unfortunately, this system is not always delivered equitably. There are many known inequities in pre-hospital care, whether it be pain management or cardiac arrest care.
We developed and implemented interventions that were novel, multifaceted, and operated on several different pathways to reduce moral injury and distress and increase equity in community paramedicine in San Francisco and throughout the state. Because we view moral injury and equity as integrally related, operating at both systemic and individual levels, our interventions were also designed to address moral injury and equity.
We implemented several interventions aimed at supporting our street response teams, including peer support conversations, crew meals, and enhanced internal and external recognition efforts.
The feedback we received from members for these interventions was very positive. One person said, "I definitely felt that these sessions helped myself and my coworkers feel more connected to our jobs and to each other."
Another participant said, "Learning more about intersectionality and moral injury helped me understand more about the larger picture. It was nice engaging in critical thinking with my fellow coworkers. I felt a sense of community."
This is the first study to explore the prevalence of moral injury among first responders and its correlation with mental health and burnout. We found that first responders were frequently exposed to potentially morally injurious events, and that moral injury symptoms were common and strongly associated with mental health outcomes and burnout.
In order to understand equity more fully, we hosted the first ever EMS Data Equity Conference in California, which brought together agencies from 22 counties to discuss and advance equity in emergency services.
At the conference, we shared our own equity analysis and the strategies we developed to improve equity in our programming. Other agencies shared what they are doing to improve equity too.
We have been hosting a year-long EMS equity learning community, which has brought together leaders from agencies across the state. Over the course of the year, we engaged in monthly sessions to foster a deeper understanding of equity and how it impacts EMS work on the ground.
One of the things that we've been doing in this year-long learning community is not only seeing the problem and understanding the problem, but working together to come up with solutions to actually address the problem.
As we look to the future, the work we've started here in San Francisco has the potential to transform emergency response across the country. By focusing on equity, mental health, and the well-being of our first responders, we're building a model that others can follow.